All right. So the intention of today's talk is to talk about youth sports injury prevention. The goal is to define the epidemic of youth sports injuries, discuss common injuries, and define risk factors associated with those injuries. And at the end, have a discussion about how to prevent injury in both the chronic and the acute cases. So here's my quick background and why I get to give this talk today, in addition to a very nice and succinct background that I just got. I'm a physical therapist. I work in the sports medicine clinic at Husky Stadium. I went to Western Washington for undergrad and NYU for grad school. And in addition to my roles, I also work as a strength and conditioning coach at Pocock Rowing Club. I was a rower myself from high school all the way college and all the way through the master's level. And I'm also the team physical therapist I was the team physical therapist for Seattle Ride Ultimate Frisbee when they won the World Championship in 2018. So I see the gamut of youth athletes. My youngest patient's been 6. My oldest patient has been 99. So I've seen everybody, I've seen everything. But the intention of today's talk is for the youth athlete. So just to give you a quick background, what is a physical therapist? That's kind of the number one question I get from my youth athletes when they come in to see me. So here's my elevator pitch. I help you move better. My goal is to provide preventative services, give you a clinical diagnosis as to what's going on, and interventions and rehabilitation of those injuries. And if I can't manage it, make sure to resource you and refer you to adjunct professionals as well. I have a doctoral degree, I've passed my licensure, and I have a professional specialization as well, right? And the New York Times did a great article last year, how not all PTs are created equal. So I just wanted to take a moment just to acknowledge that and to acknowledge the fact that I treat in sports medicine, and that the view of what I will be sharing today is through the context of sports medicine, which is great for a sports medicine talk. However, not all PTs are created equal. Sometimes it's like a Pinterest fail if you're asking like an aunt or a family member for advice, just like what it is with anything in medicine. So I just want to take a moment just to acknowledge that. I work in Husky Stadium in the Sports Medicine Center. We offer sports medicine, orthopedic, and family medicine services. In addition to PT, we also offer sports performance, preventative measures, and injury prevention clinics as well. So for the context of today's talk of youth sport injury prevention, if we zoom out and we look at the benefits of sports for youth athletes, they're multifaceted. There's benefits for teamwork, socialization, leadership, discipline, and exercise. And this is long lasting. The ability to develop and improve cognitive skills, it moves from elementary to middle school to high school. And specifically with high school athletes, they're more likely than not athletes to attend college and to graduate from a 4-year college. And they also have a higher percentage of A- grades. And so you think of the stereotype of the jock, of a jock not being a great academic performer. That's not necessarily true. And there's a physiologic reason for this as well, is that when we move and exercise, then that actually activates different parts of our brain that help us learn. And it's not just motor learning from movement, it's additionally cognitive learning from listening, from reading, and from creating as well. So the photo on the right, of my right, is that this cortex area of your brain as to what gets lit up with blood flow that's coming to it after just simply a 20-minute walk. So,
Dr. Geller, so
yes.
Sorry to interrupt. You are not screen sharing right now.
I'm not? Okay, that's what I was asking before. So. Yes.
There we go.
All right. Can we all see this now?
Yes.
Beautiful. All right. I just wanted to make sure. All right. So active kids do better in life. So here's what the research shows us on the compounding benefits, right? Physically active children, 1/10 is likely to be obese, roughly 40% higher in test scores, less smoking, drug use, pregnancy, more likely to go to college, on average, higher annual learnings, and lower health costs. So that's great. That sounds like that's amazing, right? So what's the problem though? Well, 30 million children participate in organized sports annually. About 23 million of those are in the elementary middle school level. And then there's a huge drop off to about 7.3 million in high school. And that's increasing yearly though. Yearly injuries, there's about 4 million youth injuries a year. Over half of those are the high school athletes, and that accounts for over 500,000 doctor visits and 30,000 hospitalizations. And on average, the rate and severity of injury increases with a child's age. So that's why you start to see the higher rate and the higher severity at the high school level. It's more competitive, it's more physical. And over 50% of these injuries are preventable. And the reason that's important is that a child's history of injury is a risk factor for future injury and a contributor to long-term degenerative diseases such as osteoarthritis. 70% of kids participating in sports drop out by the age of 13 because of injuries, coaches, parents, adults, and because it stopped being fun. And they're going to lose the benefits of exercise, teamwork, and healthy competition. So young athletes tend to specialize in sports and positions at an earlier age. And what's happening with this is that athletes are playing longer seasons. They're playing year round. There's not enough rest between practices and games. And that fatigue sets in. So now they start to get poor training on immature bones. And we have coaches that are starting to treat kids like adults when they're still kids. And we have this unique dynamic of like the overbearing parent and coach saying you need to be doing more and more. But really what the research is showing and what that supports is that the majority of the college, pro, and Olympic athletes played multiple sports growing up, and they did not specialize early. And the thought process for that is that you're just creating a global movement library that you can pull from for your individual sport. Much like it is in learning and education, to get a broad spectrum of education first before we start to get more specific, it seems to hold true for movement and for sports as well. So over half of these injuries are overuse injuries, meaning that it's because we did too much playing, too much practicing, too much of one thing. And these injury rates are rising every year. And these occur both sports specifically and injury specifically. So a sports specific injury would be something like basketball or baseball. Stay with baseball for an example, where like maybe, I got beamed by a pitch, or like the ball hit my hand, like what happened to J-Rod. Or something that's injury specific, meaning that, I tore my hamstring, or I had a hamstring strain, and now that's preventing me from doing my sport. So one will certainly influence the other, and it's kind of a chicken and egg thing. But the underlying factors of all this are fatigue, overuse, and improper warm-up, training, technique, equipment, and sometimes being at the wrong place at the wrong time. And so the biggest thing, or perhaps the best graphical representation that I have seen of this is this Goldilocks zone of training.
Clearing it out.
Yeah, I cleared all the recess, and then I got back in my contacts.
Please make sure you're
What's
on
that?
mute.
That
Okay.
unknown.
Yeah,
Yep, sorry, I thought I had a question there.
so maybe.
Let me
that-
make sure I get back there. All right, it's coming through. Back to where I was. And so this Goldilocks training of model is that fundamentally we're trying to find this sweet spot of training, trying to find the optimal training load zone where we aren't doing nothing, like where a lot of kids are right now at this point of summer, where if they fall sports are ramping up this season, and if they haven't been participating and they've just been resting, then they're going to be at this far on my left side of the screen where they're underloaded. And as they go through and they start to get back to 2-a-days, like with football, for example, they're going to start to ramp back up and get into this increased risk of injury zone. So the first 2 weeks of the season have one of the highest injury rates throughout the entire season. And additionally, At the end of the season, where now the repetitive fatigue throughout the season has now kind of gradually increased, there additionally is another increased risk of injury. So I always find that it's helpful just to kind of talk through this timeline, just to understand how long physically does it take to recover from a practice or a game or an activity. And the physiologic timeline is that we have this baseline level of where we're at, and then we have a training session. And after any training session, there's going to be a recovery time, and that can last up to 2 or 3 days. That's why we have soreness for 2 to 3 days. But what happens within that time zone, if we get the right dosage, then we get this process of supercompensation, where then we actually adapt to it. And as we continue to train, then we can increase that. However, if we train too infrequently or too frequently, we have not given our bodies enough time to adequately recover. And by doing so, we have depreciating returns of what our body can handle and the capacity for this. So again, think about that graph that's on top. That's maybe something that's happening right now for a lot of the high school athletes as they're ramping back up into sport and playing summer season and a spring season and a winter season and a fall season before that, where we start to get depreciating returns. Or the graph on the bottom, staying with the same high school athlete who's only playing football. He hasn't played football since like October, November last year. And so there's been a huge break, like a 10-month break almost, of training too infrequently. And so it's going to take his body a little bit of time to adapt and to recover. So within this model of time frame of recovery, it's also being influenced by the environment. It's not just the activity itself. It's not just the sport itself. There's so many other factors that are influencing this. And and one of the better analogies of that I've seen is this threat bucket, basically of like, what is the capacity of your body right now to handle all of the additional environmental factors, like sleep and nutrition, right? Am I in midterms? Am I in finals? What's my relationship with my parents right now? Did I just come back from vacation? And all of those environmental pieces kind of add another drop into this bucket, in this imaginary line. And if those environmental factors exceed the individual factors for what somebody can handle, then that's when pain and that's when symptoms can start to occur, or at the very least, a reduction of performance. And so that brings us back to this Goldilocks training model again, of the fact that the Goldilocks zone is not static. It is dynamic, and it is shifting on any given day and any given time. The more time you spend within that Goldilocks zone, the more time it'll start to push it out, and that green zone will get bigger. But having an understanding and honoring like all the environmental factors will additionally help the sport-specific factors have a decreased risk of injury, decreased risk of injury frequency, and decreased risk of injury severity as well. So as parents or as adults or as loved ones, how can we understand what signs of playing too much are for an individual or for our children? Is there pain? Can they now put weight on a certain body part? Are they favoring one side? Are they having a difficult time sleeping? Are they feeling dizzy, lightheaded, experiencing unusual weakness, having like raw skin or blisters? And it could be one of these by themselves or the combination of all these as a whole. So recognizing that and honoring that as a parent, how do you know? Well, communication is key for this. So asking questions more so not just how do you feel right now, but additionally, right, how was practice today? What kind of drills did you do? How long did you throw the ball? Right? What did you learn today? And kind of asking more of these open-ended questions will then kind of help to come back into more of these specifics. And then you can be specific about what you saw, right? It sounds like you threw a lot of pitches at practice today. Maybe we should just run around the yard instead of throwing the ball and give your arm a rest. Can be a really helpful way just to frame and to model what you saw, what you recognize, and then give them an opportunity for some kind of variability so that they aren't shifting into that red zone of getting overworked. So before I continue on to more specific injuries, I just want to take a pause and see if there were any questions about more of this kind of global framework of how we're looking at injuries themselves. All right, so it sounds like none. So we're going to talk through specific injuries now. And the way that I've broken these down is that there's overuse injuries and there's acute injuries. So again, half of injuries are due to overuse. The other half occur because of acute injuries or trauma, right? So we're going to go through these one by one. And we're going to spend the majority of time kind of talking about these growing pains, right? And pain, like growing pains in the knee and in the elbow and in the heel. And what occurs with this time is that when somebody goes through a growth spurt, their bones grow faster than their muscles and their tendons. And so tendons are the part of the muscle that attaches to the bone. And that's a transition area for how forces are distributed. That's what that allows us to move in different ways. And what happens is as that bone has grown and expanded, is that it takes more time for the muscle and the tendons to adapt to it. And if they're continuing to do an activity or a sport that places strain on these structures, and they continue to push through and push through and push through it, then that can cause pain and a pain cycle of, oh, it hurts when I do this. I don't like, I used to like doing this. Now I don't like doing this. So I'm going to stop doing it. So having an understanding of what we're working with and being able to manage this and to manage the activities is really paramount for ensuring that these youth athletes can continue to do what they really enjoy doing. So when it comes to jumper's knee or like the knee pain, Osgood-Schlatters disease is a big fancy way of saying I have pain where my quadricep muscle inserts to my shin bone, and that pulls on the patella tendon. And if it's on the other side of it and on the kneecap side itself, that's called Steiner-Larsen-Johansson syndrome. This additionally can occur at the heel, which is called Sever's disease, which I thought was just a horrible way to name something. But essentially the same thing's happening where you go through a growth spurt, the Achilles tendon starts pulling on the bone. Your heel bone is called your calcaneus. And then that can cause pain, irritation, and a worst case scenario as to what's shown within this demonstration is that it's not just where the tendon that has irritated on the bone, but it's the bone itself that then can have irritation and pain. Little leaguer's elbow is a repetitive stress to the elbow along the inside of that. And again, think about it as this: did we go through a growth spurt, and are we putting a lot of demands of a certain activity through the arm shoulder complex, in which case the tendons that insert to that part of the bone then are getting pulled and getting irritated. This is also true for little leaguer shoulder, where the muscles that insert on the humerus or the ball that goes into the socket of the shoulder blade then start to get irritated. Similarly, for the back, this is called a spondylolysis, where there's irritation to a anatomic structure called the pars interticularis, or a spondylolisthesis, where there's not just a microfracture or a stress fracture of the bone itself. There's actually separation of the pars from the vertebrae itself, and that can be very, very painful. You tend to see that a lot with gymnasts and rowers, and those that are doing a lot of repetitive spinal extension and like back bend activities. So extreme forms of what can happen in staying specifically with little leaguer's elbow is that the ulnar collateral ligament can then it will then be forced to take on more load, and that ligament, which connects bone to bone, will then could get torn and ruptured. In those cases, then it needs to get repaired, and that's where you hear about Tommy John surgery, where basically that ligament has to be repaired or reconstructed, and it gives a pretty noticeable scar along the inside of the elbow. And I just want to take a moment just to kind of go through some of this data and just showing that like the injury, the surgery for this specific injury has vastly increased over the last 20 years. And this is only data up to 2020. I'd be really curious to see what this is a few years down the line after there's been some forced rest due to COVID, or just sudden ramp up if those injury rates and the surgery prevalence is increasing or decreasing. So in Washington State, I put this slide up just to show you what our sports specific and state regulations are for individuals that are pitching and that are throwing. And so essentially, like the more pitches that you would throw in a game, the more days of rest that you would have to have before you can throw in another game. And the intention of this is to give the body enough rest to be able to adequately recover from the unique demands that come from pitching. Now, every state has a different variation of this. So the pitch number is not hard and fast, but the intention of trying to manage the pitches has been recognized that this is one of the most important things that we can do to reduce this injury prevalence. Now, pivoting more to muscle strains, a strain is a tear of the muscle. It could be a slight irritation. It could be a partial tear, or a grade 3 is like a complete rupture or fully torn muscle. And what occurs with these muscle strains is that ideally, muscle should be pliable. It should be plastic and elastic and be able to slide and glide over each other. But after a strained muscle, there's diffuse function and increased pain. So the amount of motion that muscle is being fully loaded through ends up being just a little bit less, as opposed to working through that full arc of motion. Or conversely, it's not able to meet the demands of high speed, high intensity, high power activities. And that can lead to scar tissue being formed within the hamstring muscle itself, if we use the hamstrings as an example. And so when you see like football season's coming up, and if you see somebody with a hamstring strain on your fantasy football team, that's kind of an indication that, oh, hey, this is something that's going to take a little bit of time to rehab. If we go back to do this too fast, too soon, there's going to be decreased function. There's going to be increased pain because we haven't given the tissue adequate time to remodel itself. And it can remodel. It just needs ideal rehab. It needs ideal load and segmentally moving back into the demands of the sport, as opposed to doing nothing and then going back and getting overloaded. Pivoting now to sprains, right? So sprains, we're talking about ligaments again. So ligaments are bones that the part of the body where one bone gets connected to another bone, and that can occur in the shoulder, like a shoulder sprain, like, oh, I fell on my shoulder, right? Skiing, snowboarding is very common with that. Ankle sprains, right? I'm sure everybody's twisted their ankle. That's a type of sprain. Or a knee sprain of the LCL, the MCL, or the ACL, which is what I think we commonly think of when we hear a knee sprain, right? So a sprain, again, has different degrees. It could be a partial tear or it could be a complete tear. And in those complete tears specific to ACL, it tends to be that surgery is not the only option, right? But it tends to be the best option for returning to a sport in which cutting and pivoting is demanded for it. So sports like soccer and volleyball and basketball have a very high injury rate of ACL tears because of the unique demands of those sports. Sports like rowing where there's no rotational demand and you're staying like on a slide, moving into flexion and extension, have no demands for, or very little demands, I should say, of the ACL. And that's a sport that if you did have a tear, you might be able to get away without having surgery, as long as your knee is mechanically stable. So to talk through a gender risk of ACL injuries, females have a much higher rate and risk of injury than males do. And that increases by age from 15, 16, 17. And that's probably most likely due to just going from your freshman year to JV to varsity. And then at 18, right, there's a reduction on both sides. And that's most likely due to the fact that it's like, if I'm not at a varsity level, I'm getting weeded out from the sport. So unfortunately, there is some drop off. Or at 18, I am playing a varsity sport, and so I am proficient within that sport, and my body mechanics are good. And then you see that at 19, then that there's a huge increase, and it's kind of the same idea as like that spike that happens at 15, where there's a transition to collegiate athletics, and that the demands of playing at 19 against 23, 24-year-olds, right, are significantly different than an 18-year-old that is playing against a 15, 16-year-old. So, like I was saying before, ACL injury rates, by sport, women's soccer, boys football, women's basketball, gymnastics, tend to have the highest rate of injury per athletic exposure hours. And if we start to look at what this is as far as surgery goes, is that essentially like those males and females that are under the age of 25 are having a significant increase of surgery for this, because the demands and the competitiveness of all sports at this elite high school level is getting much more competitive. So how do you so how do we reconstruct in ACL? Well, there's different parts of the body that you can take it from. It can come from the patella tendon, which is just at the bottom of the kneecap. You can take it from the hamstring, which is the muscle on the backside of your thigh. And then they essentially drill a hole from one bone into another called a tunnel. And then they put that tendon in between it, and that will eventually remodel into a ligament. The rehab for that takes at the very least 9 months, but typically more closer to a year in my experience. And I see a lot of ACLs within my practice. But I just want to take a moment to pause on this stat, because I think this is really important to resonate, where re-injury rate decreases by 51% for every month you delay return to sport postoperatively until after 9 months of surgery. And you're 4 times more likely to get re-injured if you come back before 9 months. So when it comes to rehab and working with myself within the physical therapy setting and within a sports performance setting, what I see a lot of times is that the athlete is feeling good. They are not having pain, but their body is not yet prepared for the unique demands of their sport. And it takes time to be able to revamp and adapt to that. And that's one of the main factors of this, is that it's not just the knee itself, it's the body as a system as a whole, and working on energy system development. So body conditioning, cardiovascular conditioning, getting practices, getting the scrimmages, and then getting some simulated game settings before going back to a sport is vital for this. So now just talking through just last few injuries of slides that I have on here. We have some bony fractures as well, and that's thinking more like through the contact sports, specifically of football, falling off of a trampoline, right? Just wrestling with a cousin and falling off of a couch. You can have any kind of these, traumatic injuries or bony fractures. Other form of trauma could also be concussion, and I see a lot of that within my practice as well. And a concussion is simply a brain injury caused when the force from a blow to the head, or there's sudden deceleration or whiplash, and and what occurs is that the nerve endings and the blood vessels are stretched or perhaps even torn as the brain rotates and rebound. So a concussion is essentially a brain injury. And what the vital part of this and of concussion management is honoring what the symptoms are and recognizing that, just like anybody with any kind of brain injury, is that it's not like a cookie cutter approach, and that it's not one size fits all within their symptoms. So a cluster of symptoms are headaches or difficulty concentrating, dizziness, blurred vision, nausea, slowness in thinking, speaking. And they happen most common in contact sports like football, hockey, soccer, and basketball. So the other part of this is that I think for a long time, there was this misnomer that, oh, if you didn't lose consciousness, you didn't have a concussion. Or I was able to keep playing, so there's no way that you had a concussion. And I would say, within my experience, that is not true. And within consistently throughout the literature, this also is not true, as 90% of individuals of concussion events do not cause a loss of consciousness. So again, what are the sports that have a high risk of that? It's football, it's hockey, it's lacrosse, soccer, basketball. Thinking of contact sports, thinking where the head might be hitting the ground or hitting something else, like a ball or another athlete. So the way that we return an athlete from concussion is in this graduated, slow, progressive program where they go from no athletic activity to some light aerobic exercise, and we see how they respond to this. If it reproduces any of the symptoms that are unique to this individual, right, then we would not progress them on to the next stage. And we would spend as much time at that stage as this individual needs. And I've had some athletes where, we run through these 5, stages in 5-6 days, and they're golden, and they're completely fine to come back. And I've had other athletes where we've had to spend 2-3 months at one of these stages, because we have to honor the healing process of the body, and we have to trust that the body is able to heal. We just have to incorporate the best environment in which it can do that. And so with the youth athletes, it's not just the sport element that needs to be taken into consideration. It's also the cognitive element of school. And I think within the last few years, this certainly has become more recognized as something that is important. But much like you would take a graduated approach to return back to sport, there needs to be a graduated approach to return back to school and back to learning and back to focusing, because it is your brain's job to be able to perceive the physical world that it's in fundamentally. And if it's having a hard time of even doing that, then how are we going to learn within the classroom or being asked to concentrate all day long? So taking a day or two off school, oftentimes from that concussion event before returning back to school, it can be very helpful. And then even having a few days of I'm going back to school first before I go back to practice can be even more helpful on this graduated tiered approach of getting back to playing full sports. So I know I just went through a lot of different injuries of themselves just to give kind of a broad view and a broad spectrum of that. But I just want to take another moment just to pause and see if anybody had any questions about those unique injuries or anything that popped in before.
Hi, Eli Morley. I'm sorry, excuse the noise. I just want to make sure, will there be a general Q&A towards the end? I have
Yes.
a more broad question. Well, it's specific, but it's broad at the same time.
Okay, all right. Well, we will make sure to answer that in depth at the end.
Okay, thanks.
Dr.
Anybody
Geller,
else? Yeah.
getting back to what you were discussing with the Goldilocks training and activity recovery, how is that complicated when let's say kids are doing two soccer practices a week and a game on the weekends. And then in between those days, they have recreational activity like, basketball with the friends on the hoop in the street, or, that sort of thing. Obviously, there's some overlap in body parts that are being used that are similar. There's also some different things that are being used, but how do you prevent compounding of overuse in those situations?
That's an excellent question, Eric. And I'm going to be getting into more of that in this next stage. But just to speak in generalities before I get more into those specifics of one, that's a great question. And great recognition to that point, because it gets tricky, where especially when you have kids that love to play a sport and they love to play, you never want to say like, don't do the thing that you love to do. So now the question becomes, now how can you create some variability so that it's not pushing yourself more into one edge of that Goldilocks zone? So the example you used of, like playing basketball, right? When somebody is playing soccer like 2-3 times a week, yes, you are using similar muscles, but you're using those muscles in different ways. And the ratio and demands of those muscles are going to be have different demands than the sport itself. So something like that could certainly be advantageous versus what I see a lot of, where it's, all right, I'm on a school team, I'm playing 3-4 times a week for practices and games or maybe a tournament. And additionally, I'm on my recreational team playing soccer, where they know that I have a school season. So we're only practicing 1 time a week and having 1 game on a season. And that ends up being 6 days a week of doing the exact same activity and doing the exact same thing. And in which that case, that's really going to push you into that red zone. Okay. Any other questions before I move on? Those were great. All right. Well, then I will just I'll continue on this and use that question just as a beautiful bridge for this next section of the talk. And so, really, how can injuries be prevented? Specifically, that of overuse, because that's a lot easier to prevent. Again, that's 50% of all injuries, and that these are things that we can control essentially. So, in broad spectrum, get a preseason health and wellness evaluation. Schools are great. You got to go in, have a check-in with your pediatrician or with your primary care doc. That's a great way of just looking at things like from a full broad spectrum standpoint. But additionally, right, you can come in and see me or see a physical therapist or see like a health and wellness, specialist to get a movement screen as well to see, hey, is there anything that's jumping out right now where we can help to prevent this injury from occurring? And that might be, here are some exercises to do, here's some stretches, here's some flexibility things to do, or this is a tailored warm-up and this is a tailored cool down program for you. And these are things that you should be doing as well. Additionally, ensuring that there is injury prevention programs that are being implemented by the coach before practice or after practice, or somebody else that's within the team on the strength training days, so that you're capturing this ability to reduce injury from different aspects of the training cycle. Additionally, proper hydration, proper feel, eating before, sometimes even during or after participation can be vital to make sure that you have enough energy to be able to participate in that sport, and so that you aren't going to get into a fatigue state where injury risk increases. And also having the opportunity to wear your properly fitted protective equipment. And all of this comes back to this Goldilocks zone as well, with the big takeaways of don't play one sport year round. Don't play one sport year round. Don't play one sport year round. That's probably the biggest takeaway if you take away from anything from this today. And just taking one season off each year helps the muscles recover from use, and it prevents overuse injuries. So look, if you're playing competitive, if you have a kid that's playing like travel soccer, that's amazing. Just make sure it's not year round. give them time to recover, give them opportunity to pursue like other things, or other sports or other activities or other opportunities to find joy in their life. That's the biggest thing that you can do to help to reduce injury. And within the sport itself, playing different positions. So like staying with baseball, like if you're only pitching, right, give yourself an opportunity to go into the outfield where you're still throwing, but you aren't throwing as hard and throwing as densely every single game. Or if you're playing catcher, where you're throwing more than pitchers do every single game, making sure that you're getting an opportunity both, at first base or as a designated hitter, so that your body is, so you're still involved in the game, but you're staying within that sweet spot, that Goldilocks zone there as well. And then finding other sports as well can certainly be helpful. And it doesn't just have to be something that's completely different. I work with a lot of rowers, and that's a year-round sport, and it can be. But we recommend like trying to find like other sports that are involve rotation. Like I have a lot of carryover from my rowers that they love to play ultimate frisbee. There's a huge rotational element in throwing a frisbee, or golf, like where your body needs to learn how to rotate and how to move in similar ways, but in different environments and in different circumstances that now you can bring back for your primary sport. And in turn, that movement library and that movement capacity that you have is going to vastly increase. So again, just to frame all of this, being engaged in sport bears the risk of sustaining injuries. It's part of playing sport. It's also the most common way for adolescents to injure themselves. And we know that 50% of those are due to overuse injuries. Now, when we start to look at injury prevention programs, we can reduce 50% of those injuries. We can decrease the severity of injuries by having an injury prevention program implemented at some point during the season. And the reason that this is so important is because it produces physiological adaptations. So how is my body handling the loads of the demand of my sport? And these prevention programs can be implemented pre-season, in season, or even during the off season. So the cool part about this is it doesn't matter when you do it. The biggest indicator of success is if you're doing it or not. And there's lots of great injury prevention programs that are out there. But just to kind of give a gross summary of this is that, the typical programs are about 15 to 20 minutes long. And it's not only one thing. It's working on power, strength, plyometrics, which is another way of just saying like jumping, landing, cutting activities in different forms of balance. And just doing that for 15 to 20 minutes has been shown to have carryovers within the task demands itself, but more importantly, to be able to reduce the frequency and the severity of injury as well. So the most prevalent injury prevention program, and what I recommend anybody to do regardless of sport, is the FIFA 11 Plus program. FIFA came out with this, I think it was almost 15, 20 years ago now, and in which the entire team runs through a dynamic warm-up, which is injury prevention. And it is tiered for each individual as to what they can do and what they can accomplish. So it's within a group setting, but it's also individualized on that. And I have this slide on here just as examples where, staying on the top, just a single leg hop might be challenging for some, but for others that might be really easy. So now you can scale it to become a lot harder to, give different commands, right, left, forward, back, while you're hopping on one leg. And that way you're capturing in the individual challenge within a group setting, and you're introducing a component that is known to prevent injury as well. So all of these capture the proper warm-up techniques, in which the three main functions of a good warm-up, right, are to raise the temperature of the body, you're increasing blood flow to the muscles, to the brain. You're stimulating the nervous system. That's where the plyometric or balance component comes in. So you're going to prepare the body for competition-specific activities. And additionally, it primes the musculoskeletal system. So the muscles, the tendon, the ligaments are being stressed to be able to accept the forces and ranges of motion encountered within the workout or sport. Now, there's also different ways to warm up, and I am a huge advocate for all of these, in which going in to your warm up, just visualizing just what you are going to achieve within that practice or within that game, having keywords or simple keywords, you know, of things that you're going to focus on, like flow, or if the intention is to pass more, you know, pass, and that will bring in more of that attentional focus, and it really helped to stay really more specific within this. And then you can layer on top of that some form of breath work that will bring you into this quiet, alert state, and this double inhale, long exhale, brings our body back into this kind of quiet, alert state where we're more adept to learn, and we're more adept to be able to focus and to respond to things. Additionally, tying this back to the communication aspect that we had before, was like the positive talk from parents. So, you know, not parents, you know, saying, hey, have a good game, like score some goals, right? Where it's becoming more external validated. It's more like, hey, I love watching you play. I love seeing you out there having fun. I love seeing you, participate in this thing that you love to do. And this positive self-talk can really frame the experience through a positive lens, regardless as to the outcome of it. And again, the positive self-affirmations, right, that the athlete themselves can do. We're just simply saying my body is resilient. It has been shown in some literature to reduce injury by as much as 33%. So post-workout, what do? Well, you need some form of cool down, right? You can foam roll, you can do a static stretch, you can do a dynamic stretch, or even doing something like in yoga, like Shavasana at the end, and just going into a rest position. If that's all you can access in that moment, that is so much better than just trying to push through. And the importance of refueling. You need to eat, you need to hydrate, and you need to rest, recover, and getting enough sleep for that. So here's kind of just broad advice on this. Before a workout, eating 30 minutes to 2 hours before the workout, going higher carb, lower fat, and something that's easy to digest. So that's where like peanut butter toast, or like a perfect bar, or something that's just, you know, easy just to eat, but with enough time to be able to digest, right? In that kind of 30 to 120 minute window before the workout. Post-workout, you have about this 30 to 60 minute window afterwards where you want to go high carb, high protein. And that's where things like chocolate milk or like a protein shake can be really handy to be able to get the nutrients in to refill you from the demands of that sporting event or that activity. And anytime that you work out longer than an hour, your body needs electrolytes to be replenished. Water alone is not going to be enough for it. So that's where coconut water or Gatorade or Noon tablets can be really helpful on that. And then if you want to incorporate any kind of functional foods, there's tons of research and literature out there about tart cherry juice and how it helps to reduce muscle soreness or DOMS, and it also helps to have it functions on the melatonin system, so it creates a deeper, more restful sleep as well, which is kind of cool. Additionally, right, sleep is one of the best things that you can do for your body, especially after any kind of activity. And the best stat that I've been able to find on this is that athletes who sleep on average less than 8 hours a night have a 1.7 times greater risk of being injured than those who sleep more than 8 hours. So really trying to get that threshold is really important. And I know how it is, especially with the high school athletes where like their sleep schedule is just off, baseline, but really trying to emphasize that 8 hours sleep can be huge and can be vital for that as well, because you're creating a more stable system at the body level to be able to take on the more environmental demands, the sport specific demands on a day-to-day basis. So I'm going to share a couple different resources here. The Stop Sports Injury Prevention is a great resource for parents, athletes, coaches, and healthcare providers. They have a ton of great videos and resources on there that are sports specific as well. And I've put up a bunch of injury prevention and organizational resources as well, if anybody feels called to looking through that. So, any questions?
Dr. Gellert, referring back to that FIFA 11 plus program, how come
Yes.
it's not FIFA 0 plus? Why is it that kids 0 to 10 aren't included in that category? Is there significance there?
The significance is that there's 11 exercises, not the age of 11.
Okay.
Yeah, great question on that though. And the plus is that there's the option to add more to that. That incorporates more team specific or individual specific work in there as well. It's not only saying, hey, do 11 things and this is going to be enough. It's saying doing these 11 things has been shown at a minimum to reduce injury frequency and severity.
Dr. Gellert, this is Lauren. Thank you so much. Such a great presentation for a mother of two intense elite athletes. My question to you is, how do you as a parent, when your teenager or child plays these year-round sports that, they're offered year-round, right? So you pay for them year-round. And then when they do give those breaks, then you receive from the club technical training opportunities, futsal, indoor opportunities. How do you as a parent trust the process of too much is too much? And growing up as an athlete, even in college, I never specialized in a sport. So I find it really hard to my kids like to play multiple sports. So do we just kind of stay on this path of the research shows it and, don't kind of get sucked into that more is more makes you better, better, better?
That's a great question, right? And it's like anything in research. It's like, hey, here's what the research shows. And then there is the child that's in front of you and your child, right? And your family better than anybody else. So I just want to frame this answer through that lens of, hey, it's great that they're offering things year round. And the reason that they're offering it year round is because they can, and because they see that it is a business and that there are monetary gains for it, and it helps to keep coaches and staff and everybody employed from a year round standpoint. Yeah. Now, that being said, that doesn't mean that there's not advantages, to doing that. Like if somebody is having, say like baseball player, for example, right? In the off season, right? If you want to meet with a swing coach and, go to the batting cages once a week, I think that's totally fine. I think it becomes a different story where then you're going back to all of the demands of the season by doing like a travel season on top of like a select team, on top of like a high school season, that's when those things can really compound on top of each other. So I guess the biggest takeaway from that is, right, if you are going to do things in multiple seasons, like of the same sport, I would not try to do all of the demands of that. I might try to choose one or two things to work on for them that then they can come back to and do it. And additionally, exposing them to other opportunities and other sports at the same time.
Great. I have one more question for you.
Yeah.
What about, when you talked about the injuries, as kids are growing and they're playing these sports year round and overuse injuries, how much effect does that have later in life as an adult, you know, an active adult? I mean, is there any research behind these very elite athletes up to 16, they quit, they burn out, and then like, what's the behavior after, or the chance of kind of re-injuring or?
Yeah, that's a great question. And so through broad strokes of any injury, the biggest risk factor of to have an injury is the history of a previous injury. So let me speak through the lens of my practice, right? Of where I see patients throughout the entire spectrum of lifespan. So I have a high school athlete who has come in with back pain, right? They come in with back pain, we're able to manage it, we get them back to season, right? They're great. And then I see them again, like a few years later when they're in college, and they're like, oh, hey, I had back pain. And because I had it before, I knew it wasn't severe, and I was able to push, and I was able to manage it, which is best case scenario. Or what tends to happen is, oh, I had this before and now I catastrophized. And now I thought it was going to be the exact same thing that happened before, and now like I lost the season. And then that cycle continues throughout life, you know, through like when, you know, when they're like 40 and they have like back pain because they're just sitting all day, or like if they're you know 60, 70, like when they're picking up the grandkids, like and the kids, you know, picking up a kid that kind of throughout their back, they go back to this previous experience. So framing it in a lens in which teaching that their body is resilient, and framing it in a lens in which like, hey, like you can overcome this and it's going to be okay, and this is just a stormy season of life that you will pass through, is one of the best things that you can do for it, and help to mitigate the severity and the frequency when an injury happens again.
Thank you.
Dr. Geller, there were a couple of questions in the chat that people dropped in I wanted to try to get to. One from Elaine was, has pickle juice been shown to help with cramping?
I love pickle juice. Yes, pickle juice certainly can. It works both as a preventative and before sport, and additionally, when you are having cramping, like pickle juice is one of the best things to do it. There's good literature on that. I believe it's either University of Oklahoma or Texas A&M has like a full hydration department in which they're doing research specifically on the benefits of pickle juice.
That's fantastic. Catherine, do you want to jump in and unmute?
Sure, I can wait for you to read the other question before I hop in with mine.
All right. Diane said she has seen kids on basketball and soccer pitches wearing ankle braces for prevention. Are these necessary? Are they a good idea to use?
So when it comes to any kind of brace or that you're wearing, it tends to be more prophylactic in nature. There's, of the studies that I can cite, there's only one sport and one position in which bracing has been shown to prevent injury, and that's offensive linemen in elite football, so college and pros, and that's why you see all the offensive linemen wear them. Specific to soccer and basketball, there is the added advantage of feeling confident within your body and feeling safer by wearing it, and I think, you know, there certainly is an added mental benefit for that, in which an athlete can perform at a higher level, feeling more confident. But is it going to prevent something from happening? Probably not.
Thank you. Catherine, do you want to jump in now?
Sure, thank you. Yeah, so Dr. Gellert, I understand you work in injury prevention and strengthening. So I recently was listening to a podcast about strength training for youth. And so you know, my understanding for youth sports is like a classical way of thinking is, you know, you have a young athlete and you want to first develop like their proprioception, their flexibility, their coordination, and then strength kind of comes later on as the child is developing. So this idea of maybe strength training with youth is a little new to me, and I'm kind of wondering what your thought is about this. What do they mean by strength training, and like how young would you recommend for someone like a girl?
Yeah, great questions across the board. And so let me just frame it through this lens that playing is strength training specific to the sport. So just playing soccer, your legs are going to get stronger. Like riding a bike, like your calves are going to get bigger, right? There's natural strength adaptations that are going to occur just by doing the sport itself.
Mhm.
Now, what I'm hearing more specifically, you're saying strength training more from the gym. Is that what you're asking?
Yes.
Yeah. Okay. So now there had been some historically there had been some thought that lifting weights too soon could potentially impact the growth plates of the bone, meaning that the part of the bone that's growing and expanding could get insulted and prevent growing because of those loads. What the research that I've been able to go through has shown is that if you're going to implement that at a middle or high school age, it's probably not going to impact it that much. But if you're going to implement like really lifting weights at an elementary school age, it could have the potential to impact that. So my answer is going to be based off of school. For elementary school, I'd say no, right? I wouldn't give like a structured like go into the gym, do CrossFit. I'd have them play more because playing is growth and development in and of itself. For a middle schooler, I would have them be working on functional motions and functional lifts. So meaning like, can I squat? Can I balance? Can I push? Can I pull? Right? Like so like a squat and a deadlift would be good examples of those, right? From a high school athlete, there's no demands from that, and the strength will directly affect the power and the explosiveness that they have for sport. So as long as they have the proper body mechanics, you'll be in good shape.
Okay, thank you. And if I may, I do have an additional question.
Yeah.
Yeah, so on the flip side, talking about flexibility, so I work with both youth athlete as well as college students, and so they're kind of opposite end of the spectrum here, where college students, I work a little bit more on mobility to try to help them increase their range of motion, but then with a youth athlete, with this girl, she's still building up her flexibility. So my question is about like, mobility versus like static type of stretching exercises. This girl, the youth athlete, she is not as flexible as some of her peers, and we're trying to build her range, and I'm wondering like how far can I push the static stretching, or should I be switching over to mobility if static isn't really working for her? So what are your thoughts on flexibility regimens?
That's a great question. And you kind of touched on it within your question, is that it's going to be individual specific. And so there's the individual and then there's the sport. So what sport does this athlete play?
Sure, Taekwondo.
Taekwondo. Okay. Right. So you need both flexibility and mobility for that. And just to talk through those, when I'm saying flexibility, I'm saying that's more from the muscle itself. When I'm saying mobility, that's like more the joint and how much motion there is at the joint itself. So for anything in martial arts, you need both. So I would then prioritize, what does the athlete like the most? Like what have you done with this athlete that she likes?
She likes challenges, actually. So, know, I tell her, try to go down an inch a little lower every month, if she can.
Yeah.
And, she will go out and do it herself.
Okay, good. So does she, but specific to like more like static stretches or more dynamic, that's what she likes? Okay, so I might just frame it around that, and try to keep it enjoyable and try to, create micro goals of achievement on the way to a larger goal, right? So like, oh, can you touch your toes? No. All right, how about like, can we get to your knee in the next month? Like something like that. And then I would try to create as many different experiences within a training session in which you're going to be working her through as long arc of those motions as possible. So it's not just like I'm stretching into this, it's like now I need to use that throughout that full range so that the brain knows how to talk to the muscle throughout that full arc of motion, as opposed to just only a small part of that.
That's very helpful. Thank you.